Is it time to let patients pay extra to queue skip the NHS waiting lists? 0207 862 2222 is the number to give us a ring. So a new opinion poll has found that 40% of respondents said that they would be open to paying extra if it meant that they could have operations more quickly. Now, they would also be happy to pay more to get routine things like optician checkups and mental health appointments. And it comes at a time when waiting lists for NHS treatments in general are an all-time high. I mean, so Albie, would this be a way of maybe the NHS getting more funding in?
Look, you can already pay to get quicker healthcare if you want to. You just take out a private health insurance plan. I have one, lots of people have them with their employers, or you can just self-pay at private hospitals and private GPs and things like that. Now, the question of whether or not the NHS should be offering something similar, I'm not really sure, because the whole point of the NHS is that everyone's treated equally and that it's free at the point of use for everyone. Now, I think that's where I might make a change personally. I think actually, well, why can't people who can afford to make co-payments, for example, make co-payments for their treatment in the same way that we do with NHS dentistry, for example? Because ultimately, the issue with the NHS is part of it is there's not enough funding, so co-payments would help with funding. But also another part of it is actually how it's run, how it's organised. Do we need to look at a completely new system for the NHS? Maybe something more like the health insurance, the European social insurance schemes that we see in countries like Germany, France, Belgium, Australia, where there are better outcomes and people make co-payments.
So you would be looking at making co-payments but staying in your same position in the waiting list rather than being able to pay to queue skip, is that right?
Having co-payments and reforming the NHS to a more modern system akin to the rest of Europe and Australia would improve patient outcomes, it would make services quicker to get for everyone, and it would increase the amount of money going into the NHS. But if you want quicker treatment now, you can get it. Get a private health insurance plan.
Well, I mean, it is kind of already happening, Emily, except for the money goes to private firms rather than the NHS.
Well, I think Andrews Bevan, who of course set up the NHS in 1948, would be, rolling in his grave if he were to even hear us talk about things like that, because the whole point of the NHS is equity. It was set up so it's free at point of delivery, free at point of entry, and if you introduce payments, whatever they may be, co-payments or you pay to queue skip, then you're introducing tiered systems. It's not just a double-tier system where if you have more money, you get seen more quickly and you have better treatment. It's like multi-tier systems.
But we already pay for prescriptions. We already pay for dentistry.
The problem is, Storm, that, a fifth of people are on NHS waiting lists in the worst hit areas. And if you introduce payments, it will be that if you can afford it, then you will be okay. But if you can't, and it's often the poorest areas that have the highest, amount of need, that just exacerbates the situation. It gets more and more.
Isn't that already happening?
Those people don't get seen. I mean, look, actually, I agree in some respects with Albie. I think we're kind of getting to crunch point. I mean, I hate myself for even saying this. We're kind of getting to crunch point with the NHS. The government's, Labour or Conservative, they're putting more and more money in, but we're living longer. Treatments are better now. Cancer is not a life sentence anymore. It's not necessarily death. It's a treatment now. You can recover. But all of these things cost money. And more and more money's been put into the NHS, and it can't, but yet doctors and nurses are leaving in droves. I don't think it can be sustained. I think we need to have, it has been such a sacred cow, the NHS, that no government has ever really wanted to look at kind of root and branch reform because of Andrews Bevan, because of, it's such an amazing thing. But I think something does need to be done, because pumping more money in, it doesn't seem to be the answer.
Let's go to the calls. Hazel from East Ayrshire, what do you think when it's even the suggestion of paying to skip NHS queues?
Good morning.
Hi.
Firstly, I had quite an interesting experience. I went to my local surgery on the 18th of March with a sore right leg. I couldn't put any weight on it after a 5k run. I was given painkillers. There was no follow-up. I did see a GP. It was suggested that I seen a sports physio, so I made an appointment at my surgery for the sports physio, and the first appointment I could get was the 18th of April. So I went home and I was in excruciating pain.
For a month? About a month?
What happened was I was in excruciating pain for about a fortnight, and I decided something's not right with my right leg. As I said, the GP said it was soft tissue damage. And I booked in with Nuffield for a sports physio appointment at East Kilbride. And I saw her, and she saw how I was walking, or as she put it, hobbling. And she suggested I needed an X-ray, just to see exactly what had happened.
Right.
So I fought tooth and nail with my local surgery to get a referral, because they just didn't want to give me an appointment, didn't want to let me see anyone, weren't interested. I eventually phoned 111. They told my surgery to give me a referral for an X-ray. I said I'm happy to pay for that X-ray. So I eventually got the referral. If you go private for an X-ray, you still need an NHS referral.
Right, okay, I see.
Yep, so long story short, I had my X-ray on Thursday there. So this is now 3.5 weeks down the line. And Nuffield called me after I left the Nuffield Hospital in Glasgow, had my X-ray, took 5 minutes, absolutely seamless. And they told me I had a broken hip.
Oh, Hazel.
And told me to go to accident emergency immediately. So I ended up at Cross House Hospital in Ayrshire, and I was in there until Monday there, so I'm just out on Monday. I got operated on Saturday, and the care that I got at Cross House Hospital was absolutely excellent. I arrived there at 12 o'clock noon.
So,
on
Hazel, just confirm something with me. First of all, I can't believe you're hobbling about for 3 weeks with a broken hip. That's unbelievable. But second of all, the Cross Hill Hospital you're referring to? Cross House. Is that a private or an NHS hospital?
That's NHS.
That's NHS.
So
how did you manage, because it feels a little bit like you queue-skipped there. No accusation,
Yes,
Hazel, at all. But how did you manage that? By doing it part private?
Well, basically, my local surgery just wouldn't give me an X-ray or put me forward for an X-ray or even give me the referral for the X-ray.
And do you know if the people that were doing your X-ray and saw you privately are the same people that work in the NHS too?
No, I wouldn't believe so. It was a private Nuffield Hospital in Glasgow.
Sometimes they overlap, and the reason I'm asking that is that's part of the criticisms of this system, is that actually it's already happening, and you might be a great example of that, where people that can afford it are already using private healthcare. And unsurprisingly, if you're having to walk around with a broken hip, you'll pay all the money that you have in order to try and resolve that pain. Paying privately, skipping the queue, and then other people are having to wait a little bit longer. So maybe someone else is coming up with a broken hip that can't afford the private, that's having to wait an extra 2 weeks now.
Yeah, basically I would have waited an extra 2 weeks on seeing an NHS physio, and potentially that problem might not even have been picked up. Yeah. Who knows?
Are you feeling better now, Hazel?
I certainly am. As I said, the care I had at Cross House Hospital was absolutely excellent. As I said, I arrived there at 12 o'clock. The Nuffield Hospital had sent my X-ray results down to them. So I literally I walked into accident emergency at Cross House Hospital. I was in there 5 minutes and I was admitted within 10 minutes. So
presumably you would be for being able to pay in order to get faster treatment?
I think for me, the issue that I have with NHS, with this experience, and it's a first-person experience, and I would say that the critical care that NHS is providing, it was a hip specialist that did my operation. I got it done this Saturday afternoon. The care was excellent. Every single person that I encountered in Cross House was absolutely excellent, and I cannot speak highly enough for the care that I received.
Coming across.
At the Cross House Hospital, but the care that I received from my surgery was extremely substandard. And I think that for me, it's at the first point is where you need to get it right, and if you can get it right there, then the rest just flows. Right. And from my opinion, certainly it's the NHS, it's the surgeries that have the problem. People are struggling to get appointments.
You're told not to see their GP. No, you're right, even at the very beginning. Hazel, thank you very much for your story.
Well, I think Labour have got a very interesting idea, and obviously, they're on in line to get probably win the next general election, but what they want to do is they want to use capacity in the private health space, using effectively public money to pay for private healthcare for NHS patients to effectively cut down those waiting lists. In a way, that's kind of what Hazel has just said, although she paid for it herself. She went to the Nuffield Hospital, she had her x-ray done there more quickly, then she went back to an NHS hospital to have her surgery on her hip. And that's effectively what Wes Streeting is suggesting that Labour will do.
Well, I think more and more people seem to be doing that, having that sort of mix at the moment. Let's see if any of our other callers do. Roy from Wolverhampton, what's your thoughts on this? Essentially paying to queue skip NHS waiting lists.
Well, I feel myself that paying is the same whether you're rich or poor. And just because you haven't got the money, you're going to have to go to the bottom of the list because somebody else comes in with paying who has money and move up, take your place in the queue, and that'll keep happening. Until we're all standing in the same queue, it'll never be sorted out. I
feel this is a terrible argument to make, but if you're thinking purely economically, Roy, you're not seeing people as humans, you're going to see people as economic droids in order to, pay their taxes and contribute to society. Is there an argument to say that those that can afford to queue skip are probably more economically active than those that can't, and therefore it benefits society as a whole to get them healthy, back working, paying taxes in order for the country to move a little bit more smoothly, in order for the NHS to have more funding?
You just leave the poor in pain until they can afford to pay. But my situation was very similar to the last caller. I was down for a hip operation at the private hospital. They put me in touch with the military and they said, right, we don't really feel you need an operation. So was the private hospital doing it for money or because I needed it?
Well, that's also,
I didn't get the operation.
Roy, I hear your concern there actually, and something for people to keep in mind, maybe if they do go private, whether they really do need something or not. You'll never know whether someone's trying to save money or someone's trying to get money, I suppose, in that way. Thank you for your call. Peter from Mid Glamorgan, what's your thoughts on this? We're talking about paying for faster NHS treatment.
Oh, good morning, Storm. Good morning, panel.
Hi, Peter.
It's always happened, basically, because about 20-odd years ago, I had a serious knee injury, and I couldn't straighten my leg, and I knew there was something really, really wrong with it. So I went to my GP, asked to pay private to see a consultant, who was an NHS consultant. Saw him within 2 weeks, but it would have taken me over a year. He diagnosed it and said, basically, you need an operation. I'll try and be quick. You need an operation. If you don't have an operation quickly, you won't be able to walk again because you won't be able to straighten your leg because of compartmental syndrome, because your muscles die and things like that. So I saw him another week later then, and he said, I can't get you on the NHS list, so you've got to go private. This is an NHS surgeon. This is 20-odd years ago. So I had to pay. I had to have the operation. So I had to pay. It was £5,000 in those days. I had to get a bank loan. So people still pay to jump the queue.
So what you're saying is actually this, I mean, this is news today, but actually this has been going on for 20 years, as far as you're aware.
Probably longer, yeah. Probably longer, yeah. Because you can go to the GP and say, I want to pay for the consultation. So you can jump the queue then in the NHS, not just go private, but jump the NHS queue.
Peter, this has been going on.
Years and years and years.
Peter, as you say, this has been going on for 20 years. I have heard nothing but every winter of my life, and I'm 30, the NHS is in crisis. You've heard what all of the other callers have said. The service that people are getting on the NHS is just not good enough. Is it time we just said, right, it's time to think of what the perfect health system would be if we were starting from scratch now? It's not the NHS. Let's create it, reform it, and do it from 2024 onwards. What would it look like? Is it time to have that conversation?
Well, I agree. There's many conversations that needs to be had, I think, and reform is definite, yeah. I think start with paying doctors the money they deserve, because then they wouldn't have to go to private practice. Because doctors' contracts are on sessions, and a session is one morning or an afternoon.
Yeah.
So they'll have 10. If they work Monday to Friday, all day Monday to Friday, they'll have 10 sessions. A lot of them don't get contracted for 10 sessions, especially surgeons.
No,
they might only work 3 days NHS.
They're going private, which is why, private. Peter, I need to wrap this up, but which is why at the beginning I said, well, isn't this potentially already happening, apart from the money that you're paying to go private isn't going into the NHS, whereas if you were paying for faster treatment on the NHS, at least that money would be going to the place that it's most needed. I don't know. Peter, thank you so much for your call. Thanks for all your calls on this.